Hi, I'm Kylie. I'm the benefits manager here at the consortium. We are your health insurance, and we do run a wellness program where we send out monthly wellness emails to promote different webinars and activities to keep healthy living at the front of your minds each day. So if you are not subscribed to our monthly emails, feel free to visit our website and you can subscribe from there, which is healthconsortium.net. Today we have Jason from Excellus to present on preventative health. So we can all kind of know what screenings we should be looking for depending on our age, and have that discussion about staying healthy. So without further ado, I'm going to turn it over to Jason.
Thank you, Kylie. Hi, Jess. How is everybody? Thank you for hopping on today. Hopefully, you've got your lunch ready to go. Hopefully, it's something healthy. So today's topic is our preventive health workshop. I'm happy to present this to the Greater Tompkins Consortium. So in terms of what we're looking at, what we're going to be discussing, the importance of preventive health. Obviously, you play an integral role in your own healthcare and prevention. Hopefully you have a primary care provider. That's a critical piece of all of this. Hopefully you're scheduling your annual visits. We'll also be talking about getting prepared, right? So it's leading up to going into having a specific healthcare visit. Some of the things that you should be aware of and just get prepared for your upcoming visit. Preventive screenings, covered in full, those types of things. And then we'll talk about some specific related benefits. If there's any questions throughout the course of today's workshop, please feel free to, you can put them in the chat and then we'll address them at the end of the discussion today. So jumping right in here. So the three reasons why preventive screenings are so very important. And you hear this often, at any point, early detection, right? So the earlier that you can find and screen for a specific type of chronic condition, the better that treatment, the more effective that treatment is going to be. So early detection does save lives. Stay healthy inside and out. Finally, take control of your health. So think of the analogy similar to, hopefully you haven't had any sort of maintenance on your car. It is expensive, but your car needs to be, kept up. You have to have that routine maintenance. Same goes with your health, with your body being a human. 5 ways to take an active role in your overall health. So ask questions, right? So think in your mind as you have an upcoming visit, and this is that preparation. What questions do I need to ask? What does this mean? What does this mean today? What does it mean next week? Being prepared for your medical appointments, having any sort of documentation. If it's a new visit, understanding that you probably will have to have, medical history, medications. So be as prepared as possible when you do have those upcoming medical appointments. Keep track of your health information, whether it is, found on your provider's portal. Maybe you have your own system of keeping your health information related to Excellus. If you're an Excellus member, you can find all of that information, all of your claims, your medical history, and much more on your Excellus account. Having an understanding of, family relatives, right? So, who in your family may have had what type of condition. Having that knowledge of your family history will help you when you meet with your doctor to schedule perhaps those screening appointments, right? So my family, I have colon cancer. It's prevalent on my grandfather's side, on my grandmother's side, and mom's side. It's ovarian cancer, breast cancer. So unfortunately, I have a family history there. But knowing that I can go into a medical appointment, sharing that information with my doctor or any other chronic condition that might be out there. Take notes, right? So interestingly enough, if you have a chance to and can, jot down some notes, maybe, you can use your smartphone in a way to help capture what happened during that specific visit. And taking that information when you leave your doctor may generate more questions that you might have. Well, what does this mean? But having those notes are there. And really, this is a way that you are in the driver's seat for your own healthcare. So again, 5 ways to take that active role in your overall health. When it comes to medication, um, managing the condition that you have, if you have medications that help treat that medication, is important. It's going to keep you healthy, help you live longer, and beat the condition that you're trying to beat. Understand your medications, right? So if you have maintenance or if you have medications that you take, knowing what they do, what they interact with, when to take them, how to take them, are critical steps here as well. Your dosage is your dosage, right? So your doctor has prescribed a medication. Don't modify it. Don't change that medication unless you are instructed to do so. Always take medications as long as you're supposed to. So fulfill out that medication, whether it's for a specific time period or not, but take it from start to when it should finish when you are running out of that medication. Obviously, don't ever take another person's medication, even if you have similar symptoms. It's not healthy for you. Do not do that. Don't recommend it. So just keep that in mind. And I think we oftentimes have medications. We have a medicine cabinet where we place everything. Try not to change the package there. Try not to put, like, if you have a refill, if you have a couple left, I know you want to. The urge is there to keep organized, but keep the medications in the original containers. Don't switch them. But really, again, 5 tips when it comes to managing your medications. In terms of medications, I know that we have covered this in similar presentations with making the most of your health plan. But if you are currently on the health plan and you have your prescription drug plan here with Excellus, you can actually get your monthly prescriptions, those maintenance medications delivered right through your home. Just wanted to call out that as well. Tip 1. So in terms of being a savvy healthcare consumer, right? So just as we, shop for a car or we shop for clothing, food, whatever it is, we spend money on healthcare, and being a savvy healthcare consumer is a critical step here. So number 1, get organized. If you have a place where you can keep your medical information, that's great. Maybe it is a binder, maybe it's electronic documents, or maybe a file on your desktop, or maybe you have a tablet, a place where you can store that information and at any point share that information with a family member or a trusted friend. Tip 2. So create your Excellus login, right? You're going to be able to access that information. You can always log in and find information related to your health and health insurance. Establish accounts, like I've already kind of mentioned here. So I'm sure that you've had maybe a recent doctor's visit and you had a scan or you had a diagnostic, and being able to find out that information, having access to your provider's online patient portal is also very important, right? So you can go in and access that information at any time. Maybe you need to download that information. Maybe you need to share that with maybe another provider or something along those lines. Obviously, our regional electronic health information exchange, they do exist throughout the state of New York and throughout the country. So if you have, or maybe you haven't, I would recommend to consent, so that your health information there, you can pull that out as well. So tip 2, so staying and getting connected with your health providers. Support. At any point, if you have a family member, wife, spouse, domestic partner that's there, right, you want to be able to talk to that spouse, that loved one. In terms of sharing that information, we do recommend signing the HIPAA authorization forms that are there. So, like, for example, if my wife needs help, we have that signed HIPAA authorization. I can talk to a provider on her behalf or be in part of the conversation there. Maybe it is a healthcare agent, so somebody that can help you get the help that you need. So get support in that fashion. Here, the role of your primary care provider, you'll see PCP. Again, one of the most critical steps here is to have a primary care provider. Here, this is the individual that's going to help treat and coordinate treatment for all aspects of where you are today regarding your own health care. And it does include treating those chronic conditions. Maybe it is a brief illness. When we think of chronic conditions, maybe it's hypertension, right? So you've had elevated blood pressure for some time now, it's become chronic. Treating that hypertensive condition, how to maybe it's taking medications, but staying healthy, working with your provider, or really any sort of illness that might be impacting your health. Your primary care provider is also there, someone that is going to help with those regular health screenings, right? So, based upon my age, my gender, what should I be doing? What other preventive screenings should I have? Keep them routine, schedule them ahead of time. I think that's a very important piece. Vaccinations, right? So we're in the thick of flu season, flu vaccinations. If you haven't gotten yours already, we recommend you do so, or any other, age appropriate vaccinations. Perhaps it's your kids. I know most of them have gone back to school if you have school age kids, but staying on track with those vaccination schedules as you should and appropriately in that manner. Many types of healthcare providers can serve as primary care providers. So you'll see the examples listed here: family medicine doctors, internists, doctors of osteopathic medicine, as well as physician's assistants. So they can all kind of help you coordinate that treatment for anything that's going on in your life related to your own health. OBGYNs, as well as geriatricians, and then finally nurse practitioners. So just keep that in mind. If you do have a family medicine doctor, or maybe you are seeing your OBGYN frequently, they can serve as primary care providers as well. Do I need a primary care provider? I mean, the glaring answer here is yes, you certainly do. I think that it does help develop that relationship. It will help ensure that you receive that preventive care when you need it. Again, um, I'm in my mid 40s, having and knowing that I have that family history of cancer, right? I have to talk to my doctor. I have to get those preventive screenings when I need it the most. If you do get sick, again, your primary care provider can help treat you, or perhaps find a provider specific that maybe it's a specific specialist that's going to be there. So the best time to take care of your health is before you even get sick. So keep that in mind as we get into the colder months and being indoors. If you don't have a primary care provider, try to get one. If you haven't scheduled your annual visit, please do so. It's a critical step. So I did see a comment in the chat. I don't know, Kylie, if we want to answer it quick or if you want me to keep going.
The only comment I put in the chat was the link to the Excellus Find a Doctor tool in
Great.
case people are looking for primary care doctors. It's very helpful. You can even sort it by accepting new patients. So I figured I'd just throw it out there while you were talking about primary care.
That's awesome. Thank you so much for putting that in the chat. Actually, you're going to see it here too. So if you haven't had a chance to review in the chat how to find a primary care provider, again, decide what type of healthcare provider you are looking for, and then what are the specific questions that you need to be asking in that case. So those tips here, you're going to see: ask a friend, ask a family relative at any point that you can. I'm going to take a quick. All right, sorry about that. Frog in my throat. So in terms of knowing where your friends or family, where they go for their primary care provider, which practice is it? Ask, right? It's always helpful that you can ask your family, your friends, or loved ones, coworkers, where do they go for their primary care services? Ask another healthcare provider that you already know. Maybe you found out that your provider is retiring. What do you do next? Where can I go? Who's a reputable, provider? Who are you seeing? Why do you like them? Why do you, or how long have you been there? So it's always, a good thing to ask those specific questions. As Kylie mentioned, the online search tool, excellusbcbs.com/find a doctor, is a great way to do that as well. So you can check our in-networks and find, whomever you're looking for provider wise. We encourage you to log into your Excellus account as well. You'll get more out of it, but you can see the Find a Doctor tool that is there. And again, our health providers throughout the Southern Tier, Central New York, Finger Lakes, wherever you're located, typically they do also have a healthcare provider search tool that can be found that you can use to search. We also recommend that as well. Trying to understand that, perhaps there are shortages out there with getting into having a visit or providers accepting new patients. So certainly we try to update our information as much as possible. It's always useful to check out, the healthcare providers in your area as well. And don't be afraid to call, right? If you're looking, hey, when can I get in? When perhaps maybe might you be expecting new patients? When can I set up my next appointment? So you have to be proactive and how to find a primary care provider is a critical step for our members. So again, if you have yet to do this, if you haven't scheduled your annual WellCare visit, this is your homework. This is something that we want you to take away. Make that appointment as soon as you can. Get in with your doctor. By the year coming to an end shortly. If you haven't had your annual visit yet in 2025, we want you to do that as well. So homework for all of you. Staying prepared, being as prepared as you can. So 5 important questions to ask. So here, number 1, what is the most important for me that I need to remember, after my appointment? So I've gone in, I've spent 15 minutes with my specialist. What are my takeaways? What do I have to do after my appointment? Why have you recommended this specific treatment plan for me? What does this mean for me today, tomorrow, next week, in the future? Why have you recommended this treatment plan? What are my alternatives to treatment? And what if I do nothing? What if it's a watchful waiting situation? What do I do? Are there other alternatives to a specific surgery or diagnostic test? What are the alternatives? So try to be as prepared. These are questions that you should ask your doctor so that you can become the best informed decision maker for your own health. In terms of health risks, so if I do nothing today or if I do nothing next week, what does that mean for my prognosis in the future? What does that mean? How can I reduce my health risks going forward? And number 5, if I have additional questions, who do I talk to? Where can I talk to somebody? If I have a follow-up question, something popped up while eating dinner tonight about a recent visit, how am I going to get my questions answered? If you have a support system, a family member, or maybe it is a trusted friend with you, we encourage you to do that. An example here, within the past month, my dad has had some health things come up, and I've gone with him. I've been that second set of ears to hear where I can. My wife as well, right? So that support system is critical if you have that in place. In terms of just before I jump into advanced care planning, a couple of reminders. Maybe there is a situation where you do have questions. You're going to learn about some resources. Maybe you don't have that support system at home of actually utilizing the health plan or utilizing, your doctor's office. Maybe they have a social worker. Being able to connect with a care manager here at Excellus, certainly is something that you can do. In terms of planning for the future, advanced care is something that you should maybe at least be aware of. I know we've done workshops in the past on advanced care with Greater Tompkins and the consortium, but this is something that is put into place before you are in a capacity where you can't make decisions for yourself for your own health, but it's thinking ahead. It's being able to plan for the future should anything happen with your health. It is appropriate for anyone that is over the age of 18, but thinking about situations where your health might be impacted and you cannot make those decisions. So the benefits here, right? You're still in control. You maintain that control of your health. It'll give you a peace of mind that somebody can help speak on my behalf. It will help assure those wishes are honored. It will help start that conversation. These might be difficult conversations to have with your loved one, but certainly getting them planned, is something that we want you to do, and a great takeaway when it comes to your preventive health. Right? It's thinking about today, tomorrow, and then the future. So it'll help avoid confusion and conflict. One of those resources here. So if you don't have a living will or have any sort of advanced care planning model in place, certainly we want you to do that. So healthcare proxy and a living will are critical. So here's another action item for those that are and have joined today. So in terms of preventive care, understanding of where you should actually go for which type of care you're looking for. So again, helping you build that knowledge of choosing where you should go to go for a specific type of condition that you have. Maybe it's an acute illness, but knowing your options can actually, you can see it here, save you time and save you money over the long term. So, and we'll break each one down. So primary care, the cost, right? You're going to see a dollar sign for each one. As you go, the price could likely go up. It's the first choice for routine medical care. Again, if you don't have a primary care provider, you need to get one. They can actually do that. That first line, it's that first line of defense. So speaking with your doctor for minor illnesses or injuries. Telemedicine, a great alternative. I know we've done workshops on MD Live and telemedicine. If your doctor is not available, if you do have medical or behavioral health, you need therapy, you need somebody to talk to, you can't get in, maybe it's a long wait time, having a virtual care and that option certainly can help save you money and time, right? You can do it from the comfort of your own home. You don't have to leave. You can set up an appointment when it's convenient for you. Urgent care. So if your doctor's not available and your medical issue is not specifically life-threatening, so again, maybe something that's not applicable to a virtual visit, like a minor cut, maybe if you have a broken bone, that type of thing, strains, sprains, cold and flu, that might be an option there. But think of the costs. Think of what that's going to cost you out of pocket or up front, or if it's covered. Emergency room, again, if you do have a chest pain, something, shortness of breath, any sort of life-threatening medical condition, emergency room, the ER is the place to go. By all means, call 911 for assistance. But if you do have a sinus infection and you decide to go to the emergency room, it's going to cost you money. So just keep that in mind. So think about, and plan for where should I go? What's the best option for me with how my perhaps symptoms are exhibiting right now? Is it a telemedicine visit? Can it be done through MD Live, or should I really go to the urgent care for this, where it could not be done virtually? So again, in terms of preventive health, knowing where you're going for care, in this way, you are being the best consumer of your own health care. Preventive screening. So thinking as we head into cold and flu season, unfortunately, having your preventive screenings like those immunizations are critical. Preventive care services are covered by Excellus. You'll see here flu shots, again, colorectal cancer screening, annual routine checkups, diabetes screening. We're here in October, Breast Cancer Awareness Month. There's been many events. You'll see it on the news. Lots of information on having your annual mammograms, breast cancer screening. Again, that screening, that early detection, again, is something that's going to detect, find something before it becomes maybe cancerous, or preventing it from becoming a chronic condition. Diabetes screening. So again, we want you to make sure that you're staying in line with your preventive health checkups. Like Kylie mentioned, the Find a Doctor tool to see a full list. Again, you can log into your Excellus account. You can go to the URL listed here and then check out those preventive care screenings. In terms of, right, so if you have a family, if you have others that are, maybe you're the main subscriber, your spouse, also sharing that information with them. If you do have kids, staying on top of their well child visits, their immunization schedules that they need to at any point. But preventive care, stay on track, stay on top of getting these screening services. Going to jump into preventive versus diagnostic. So, and perhaps you are aware, but a specific preventive visit that you've had with your primary care doctor might, subject you to an additional diagnostic test, right? So we are seeing something of concern. We need to have a further evaluation and diagnostic screening for that condition. But when a visit is considered diagnostic, you will be responsible for that type of payment if there is one, copay, coinsurance based upon your plan at that point. Again, another plug for having your Excellus account, and I think it's going to be coming up soon, but you can log in, check your benefits, as being prepared going into a visit, right? You can also see what that cost is going in, if any, for that visit. So some examples listed here. So a routine colonoscopy where polyps are found, right? So they found precancerous lesions within a segment of your small intestine, your colon. The next step is to get rid of them. We need to have them surgically removed through the colonoscopy. So keep that in mind. A routine mammogram that might require additional scans, views, MRIs, those types of things, different 3D imaging, those types of tests, right? So there's more evaluation that needs to be conducted to see what's going on for that mammogram. And then also, specifically tests that are done more frequently that are actually recommended and allowed are also there, cause that there might be, additional costs that are associated with that. Dental care, just want to highlight here again, if you do have a dental through Excellus or not, the message here is to have your dental cleanings. 50% of our adults over the age of 30 show signs of gum disease. So cleanings, having your oral exams twice a year. Again, if you have this through Excellus, if not, certainly stay on track, continue to talk to your dentist, schedule those visits, have that annual cleaning as well. Going to jump into the pharmacy home delivery. So these are some additional benefits that are available here. And I did allude to this in the beginning of the preventive health workshop today. But the pharmacy home delivery is a great resource in receiving those maintenance medications. So it's a smart way to get your medications mailed to you, so you don't have to drive back and forth. It's a time saver. You can actually save money on those prescription costs by signing up. A 90-day supply, you'll get filled your medications in terms of being reliable. They're shipped to you. They're sent directly to the address of your choice. Maybe there's a situation where, like I mentioned, you're running low on a specific medication. You need to take that medication to manage your condition. You can call express delivery, and you can get your medication sent to you faster, so that you can stay on track and keep taking that medication as directed. When you receive a mail order package, we get them here at our house a lot. My wife and family, we have them sent, but that package is sent to you so that your prescription is safe, it's not damaged or altered. Again, your doctor is still prescribing that specific medication that you're taking to stay healthy, to stay on track, manage that condition as well. Again, your package is going to be sent to you to where it doesn't have that specific type of prescription that is listed on that package. Again, just a couple of call outs here. Wegmans Pharmacy, they offer a mail order service as well as Express Scripts. So comparable options. Maybe you do go to Wegmans, maybe that's your pharmacy of choice. Again, all you have to do is call. You can check to see if the specific drug that you're taking is eligible, and maybe you want to sign up, but certainly a great option and really a smarter way for you to get those medications when you need them the most. Jumping into member care management. So a lot of different ways that we try to help our membership. So any Excellus member, we have a full care management team here. So maybe you don't have a strong support system at home, or you can't get in touch with your doctor's office and have questions. We are certainly here as a resource. But our member care management team consists of registered nurses. We have a full team of registered dietitian. We do have behavioral health specialists. So if there's, any sort of stress, anxiety in your life, social work as well. So being able to connect, help you navigate through anything that life is throwing at you currently related to your health. Also, calling out the pharmacy team, right? So if you have medications, if you have questions, you can't, you're home, you're not feeling well, you want to talk to somebody. Certainly, we do have those healthcare professionals that are available. Physical therapy, all those healthcare professionals are there. So for different things. So if you have, you know, any sort of care coordination that you're looking and need help with, you can get set up. All you have to do is call our care management team. You'll see the number listed there. It's 877-222-1240. They are available 8 a.m. to 5 p.m. If you do have a chronic condition that you have, maybe it is diabetes, maybe it is, chronic hypertension or having, elevated cholesterol. We have actually pretty much a program available for anybody with any sort of chronic condition to help manage you that condition, to help with that specific expertise that might be needed from you, those questions that you might have, and getting care, right? So, I have prediabetes as an example. What does that mean for me? Where do I get the help that I need? Our care management team are here to support you. Maybe it is a series of multiple complex chronic conditions that you have. It's being a diabetic, it's having hypertension, having high cholesterol, having stress related to those conditions, managing that condition, getting the help that you need. Again, our care management team will help kind of wrap around you and identify all the needs that you have with your specific health condition at any point. Again, behavioral health. So, thinking of your mindset, that, what is this? You have questions, right? It's stressful. It's something that's it's going to impact your life at home, your life at work. You have questions. We do have a full care management team that is here at any point to help assist you in any way. One thing before I talk about WellFrame is that Excellus, we do outreach to our members. So if for whatever reason you receive a call, it's likely from our care management team. We are trying to help you in any capacity. So if you do receive a call, there's a reason for it. We're trying to assist you with a condition or anything that life is maybe throwing at you currently. In terms of care management, WellFrame is a mobile app. It's a way that you can actually engage with our care management. Obviously, you can call us at that 877 number. But if you are tech savvy and perhaps want to try out WellFrame, you're actually using WellFrame to in a text to chat feature with our care management team. So you can always have it on the go. If you have quick questions that you need to get answers for, you can use the WellFrame app to find those answers. Again, talk to a care manager, but utilize the tools that are found within WellFrame. There's a library on there. There's all sorts of frequently asked questions. You can sign up for medication reminders. There's a step tracker in there, appointment reminders, staying on track, right? So that's going to keep you moving through anything that life is throwing at you, whether it's, maybe you want to decide to quit tobacco. You've been addicted. You want to utilize the WellFrame tobacco cessation program. You can do that as well. Try it out. Lots of different great programs on there where there's a weight loss program. Maybe you're expecting a child. Maybe you just want to set some, short-term goals of having more steps in your life. WellFrame, try it out. You can download it in your app store or find it on Google Play. You can see the access code is Excellus Welcome, no capitals, all one word, no spaces in between. So a plug for WellFrame and our care management teams. Should you have any questions or need help, right? We are here to help you at any point. Coming off of the heels of the telemedicine workshop, I won't spend a lot of time on here, but perhaps it's a nice reminder that, again, engaging with our healthcare community, you do have access to MD Live 24/7, 365 days a year. So if it's something that you're looking for access on an acute illness, we have they are board certified physicians that are licensed to practice in the state of having that visit. So if you're at work today, you have a terrible sinus infection that just kind of crept up on you, you could have a virtual visit within 10 minutes. Behavioral health wise, if you are in need of therapy, you want to talk to somebody, you can't get into a local mental health provider, there's a wait list, typically 1 to 3 days there. So again, helping to increase your accessibility when you get care, when you need it, at your own convenience. So telemedicine. So when should you use that? You can see for non-emergency medical conditions. So, allergies. I've mentioned cold, flu, sinus infections, insect bites, rashes. So the things that impact us quite frequently. You could have a virtual visit and get a prescription, right? They can send a prescription to help alleviate that condition as well. Behavioral health wise, you can see listed there if it's something that's impacting your life, whether it is addiction, stress, anxiety, something's happening at home for you, for a loved one. Certainly behavioral health there. You can have a visit virtually there. So if you can't get into your doctor's office, just a great way to have and get the care that you need. If you're traveling, if you're out of state, and you have a stomach ache, cold, maybe you have a temperature, that type of thing, you can have that virtual visit. So in terms of registration, so I know we've covered how to register previously, but if you haven't had a chance to register your MD Live account, one of the largest telemedicine providers in the country, you can do that. One of the easy ways is 635-483. Just text the word Excellus there. You can call 866 if you want, if you need to talk to somebody. Reminder for anybody that has family, your spouse or dependents that are over the age of 18 have to create their own MD Live account. You will need your Excellus subscriber ID, including that 3-letter prefix. For any dependent under the age of 18, you as the main subscriber can add them to your account and start a visit on their behalf. So a plug for telemedicine, a great way to get care. Again, if your doctor's not around, you can't get in, it's the weekend, it's after hours, you don't want to go to the emergency room for that cold or sinus infection that you might be experiencing. So a plug for MD Live. So we are going to summarize it up today. Certainly want to cover here, you need to be and have that active presence in your own healthcare. You have to be, as proactive as possible when it comes to engaging with a provider, your primary care provider, etc. If you don't have one, and Kylie put in the chat, the Find a Doctor tool that's there. You can always call Excellus if you're looking, call around the provider's offices if you're looking. But if you don't have one, we want you to have a primary care doctor. They're going to help set you up, help you manage your individual health. Schedule your annual checkup, dental cleaning if you haven't already, or perhaps it is your annual mammogram or your colon cancer screening or your immunization, your flu shot, your shingles vaccination, whatever that is. Get those annual checkups on the calendar and go from there. Advanced care directives, so plan ahead. So I think having a healthcare proxy and living will is a critical step for everybody to have in place. Once you turn 18, I encourage you and your spouse or domestic partner, loved one, to do both of those. Have those in writing, ready to go, so that in any point in life where you can't make decisions, you have that at least spelled out and help to direct the care where you want it to be for yourself. If you haven't registered your Excellus account, I know we've covered I call them the big three, but if you haven't registered your Excellus, do so. Try out WellFrame. It's easy to start, and then have your MD Live telemedicine account ready to go. So the greatest wealth is health. I'm going to finish with that quote by Ralph Waldo Emerson. And with that, let's open it up for any additional questions that you might have. I'm going to stop sharing and see if anything may have come in to the chat, but certainly appreciate the time today. What questions do we have? Yep, we will send out the slide deck. You have, yes, yep. So we'll definitely send out a PDF version of today's presentation. So anything from anybody that has joined?
I'm not seeing any questions. I did want to chime in about the mail order pharmacy. All of the consortium plans do have a cost savings. So if you're getting maintenance meds and you get them through mail order, they'll mail you a 90-day supply, but it's at a 2-month copay. So instead of paying, because you're getting 3 months paying the copay times three, you'd only pay the copay times two. So there's definitely some cost savings there, as well as convenience. I mean, you don't have to worry about pharmacy hours. It comes right to your doorstep. But I just wanted to throw that out there.
Great point. Thank you, Kylie.
Would skin cancer screenings fall into maintenance?
So preventive screenings, I believe that, you could actually log in to your Excellus account and check those. I don't know off the top of my head. Depends upon, the type of diagnostic part that's going to be happening. But we can take that question back, Cindy, and get you a more definitive answer.
Were there other questions?
All right. Well, I appreciate the time today. Thank you so much for everybody. Kylie, Jess, for hosting and for having the preventive workshop. I appreciate the time.
Thank you so much, Jason. Thank you everyone for joining us. Have a great day.
Thank you. Bye-bye.